Good morning, everyone. My name is Simiran Choudhary, and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, and Win, organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025. And as we celebrate the strength, resilience, and remarkable contribution of women across the globe, it is equally important to shed light on critical health challenges faced by women, one of them being cancer. So, this session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today we are truly honored to have with us Dr. Priya Priyadarshini Nayak, Senior Consultant Medical Oncology at SUM Ultimate Medicare Hospital, a highly esteemed expert who has dedicated her career to cancer care, patient advocacy, and advancing treatment protocols. Through her remarkable work, she's not only saved lives but contributed immensely to transforming cancer care with a special focus on improving patient outcomes and providing compassionate treatment. Welcome to our show, ma'am.
Yeah, good morning.
Good morning, ma'am. And thank you so much for coming to this platform and ready to share your valuable insights with us. So, in today's session, we'll discuss early detection, breaking screening barriers, advancements in cancer care, and how women can take charge of their health. So, our goal is to inspire awareness, encourage regular checkups, and reduce the fear of cancer. So, without any delay, we will jump onto our discussion. Ma'am, I would like to start with why is this early detection so critical in improving cancer survivor rates? And if you can share some real life cases where early detection has made a significant difference.
Yeah, actually, through early detection, we can, pick up cancer at very early stage because most of the cancers are very asymptomatic to start with, or they like present with painless lump, which patients generally ignore. So, generally, with early detection techniques like various screening techniques, we can pick up cancer at a very early stage, maybe stage one or two, which are like completely curable if treatment options are provided to the patient. So definitely, early detection is critical for it improves the like survival rates in a very drastic way. In some cancers, we even achieve 100% cure rates for cancer if it is diagnosed at stage one and two. So yeah, for real life cases, I can say I remember like many cases. One of that is like I saw a patient who was in like maybe early 40s. So she used to do mammography yearly. So she uh, through mammography a malignancy of 0.5 centimeter, that is 5 was picked up, and when we did a biopsy of that lesion, we found it to be malignancy, and then we treated it. I mean, just even by early detection, the treatment, like we need minimal treatment through like surgery. Through only surgery, we could cure her completely, and till now she is leading a very healthy and normal life.
I think that's a great example which you shared, ma'am. And why we always stress upon real life example is because it inspires the others who are listening to this session. And even if they feel something like that, they can come, they have that courage to come for the detection, for the diagnosis, and everything. And if there's nothing around it, the diagnosis comes clear. I think nothing is better than that. So thank you so much for sharing that example. And my next question is, what are the biggest barrier which prevents women from undergoing this regular screening like mammograms, pap smear, or genetic testing? Because we know there are wide varieties of screening available nowadays. And how can we break these barriers, especially in rural or underserved communities where people are not much aware, or there's this so much of myths and fear around just for going for the diagnosis.
Yeah, actually, the biggest barrier is lack of awareness amongst patients. Till now, normal population is not aware. Like up to maybe 90% of population is not aware that there are screening techniques available for breast cancer or cervical cancer. Even they're not aware of vaccines available. So lack of awareness is the like most important barrier. Secondly, Even shyness among females, like they have like they're very shy to go to the hospital and get themselves examined from a male doctor, maybe female doctor. And second, third thing is like they kind of ignore things like ठीक है, cancer aware, we third thing, the thing, we will not have cancer, we our family does not have any cancer, so there is no chance that we'll be having cancer. But they kind of ignore all this, whatever they listen, also they ignore. Most of the I've seen like highly educated females also, they don't get screening tests done. I mean, they kind of ignore जब जब होगा देखा जाएगा kind of approach is there in many of the
Very,
population.
very well said, ma'am. And because of this myths and misinformation around this cancer screening and everything, we end up, at late diagnosis, and it comes out at a very later stage. So how can this healthcare professionals encourage routine checkups without causing that unnecessary anxiety? I believe you come across these kind of cases every day. So how do you approach patients like this?
We generally kind of counsel them that get yourself screened, because these are the screening techniques which are approved worldwide, and actually people are undergoing the screening technique, so it is necessary. It is not that we should not be ignoring things, because if we can pick up cancer early, the cure rates are very high. And yes, we also tell them that many people who are undergoing screening like technique also have picked up cancer at early stages, so that we have cured them. And these are the main things we counsel them, just to we keep on repeatedly telling them about breast self examination, that they can do at home itself. They don't need to step out of their home. Even we tell nowadays HPV kit is like HPV, like this pap smear HPV kit is available, which we can get a pap smear at home itself. So that kit, just we need to know the technique. We also tell them about various like home techniques that is available for screening, so that they can do at home itself if they're like shy or they're not very active to go to the hospital itself.
And since we're talking about cancer diagnosis and everything, so does a family history play a determining in women's cancer risk, and how can this genetic testing, which is available out there, help in this proactive approach?
Yeah, definitely. Up to 5 to 10% of cancers are hereditary. So we cannot say like still 95% cancer, still genetic cause is not known. But yeah, where in a family where cancer is diagnosed, and generally wherever there is genetic testing available, we go for it. So like in breast cancer, BRCA1, BRCA2, very like widely prevalent for all breast cancer and ovarian cancer patient. We do a BRCA1, BRCA2 HRR testing. So if any case like BRCA1, BRCA2 test come out to be positive, we keep on counseling that the sisters and daughters of the patient should get themselves this BRCA1, BRCA2 testing done, so that early screening can be done for them. Even there are risk reduction surgeries and risk reduction medications available, we can administer them. So we kind of counsel them, we kind of do genetic counseling for them, we kind of arrange genetic counseling for them through genetic counselors. So these are the approaches we actually take upon.
And if we have to talk about the promising breakthroughs in breast cancer, cervical cancer, or ovarian cancer treatment today, which we have, and you think is it works the best in treating all these cancers, what would it be?
See, definitely we have nowadays, the treatment options have improved a lot. There are a lot of advancements in breast cancer and ovarian cancer treatments. Now immunotherapy has also come into picture for breast cancer treatment. But the first and foremost thing for like the thing which work is the whenever the patient should be aware. Whenever the patient gets symptoms, he or she should immediately come and approach the doctor, because if we diagnose early, then only we can offer all the treatment options to the patient, and actually we can cure the patient. The first and foremost important thing is awareness. So then we have like nowadays targeted therapies which are working very nicely in like ovarian cancer, like bevacizumab, olaparib, like BRCA1, like BRCA inhibitors. We have olaparib, rucaparib, niraparib. These are the like new treatment options. They are working very good with less side effects. And immunotherapy, as I said, in breast cancer, targeted therapies, we have very novel therapies like we have this Trastuzumab deruxtecan, which is a new novel molecule which is working very good. And yeah, nowadays treatment options have improved a lot with less side effects to achieving our goal.
Definitely, ma'am. Because of this advancements in upgraded technology, we have so many other options, which can help in easy treatment as compared to the previous things which we had. Because through these conversations, I got to know how much, side effects this chemotherapy used to give earlier. But nowadays, it has reduced so much because of the targeted therapies and everything. But now AI is the new buzzword. So, with AI and technology improving diagnostics, do you think we will soon have some home based, non invasive screening methods for women's cancer?
Definitely, with like we are seeing AI has advanced a lot. Now also we have like a home, like as I was saying in cervical cancer screening, we have this kit available, the home based kit available. So with AI, we must definitely be improving in so many ways. We can arrange, through AI, we can arrange counseling sessions for them. We can actually, keep do some awareness sessions for patients. So it is like very definitely we are hoping for big advancement in cancer screening through AI approach.
Definitely, ma'am. We'll soon have that time, I believe. So, how do genetic testing and personalized medicine help in tailor-made treatments to individual patients? And are these options accessible to average patients in India? Because we have often heard the case of Angelina Jolie and everything, right? But I believe this it's a bit of expensive genetic testing. So, can everyone afford this?
No, nowadays things are very affordable. Earlier it was very expensive. It was to the genetic testing used to cost in thousands of rupees, thousands or lakhs of rupees. But nowadays it is quite affordable, and many companies are also coming up with coupons, with free coupons, so that genetic testing can be done. So it is not a challenge for nowadays. Even therapy is genetic version of the this BRCA1, BRCA2 inhibitors have come up. Like earlier during Angelina Jolie time, maybe 10 years back or 15 years back, things were a bit difficult, bit expensive. But nowadays, like everything is available. Whatever is available outside India is available in India. We have our most competent doctors for surgeries. We have most like all the advanced medicines are available in India. Even those which are not yet come to Indian market, we can procure it from outside, from international market also. It is not never an issue. In few days only we can procure it from international market. So the nothing is a challenge, we can say. Even the cost is quite, even many government organizations, many non-government organizations, they are helping a lot for the patient. Yeah, insert many patients are also insured, so this genetic testing is covered under insurance also. So it is very quite affordable and quite convenient for patients nowadays.
And these were the talk which we discussed about the new advancements, AI, and the latest technology. But if I have to ask, we have to go back to a decade. And how has the approach to treating women's cancer evolved over the past decades? And what are some of the biggest changes that you have witnessed in your treatment protocols, or let's say the patient's behavior?
Yeah, nowadays, actually, earlier patient, we used to find most of the patient used to think that if we are diagnosed with cancer, we are going to die. But nowadays, that this approach is improving, and patients are becoming aware that many advanced treatments are available for cancer. They are taking opinions from various doctors. They're making themselves, they are knowing about various treatment options. So they're getting less care. They're actually undergoing treatment options. They're completing the treatment, because earlier we used to find dropouts. The treatment dropout number of cases were very high, but nowadays treatment dropout numbers are decreasing. Maybe because pre-medications or post-medications, like uh, for like the which are actually decreasing the side effects of chemotherapy, like nausea and vomiting. Yeah, the pre-medications options have also like improved a lot, by which we can decrease the side effects of chemotherapy. By which what happens, yeah, during first chemotherapy itself, earlier I used to find patients used to like have various side effects. So they used to drop out for second, during third sessions. But nowadays they're saying it is easy. I mean, and their side effects are very less, and they can complete the treatment options. And nowadays targeted therapies are new in the market. Targeted therapies are no have no side effects at all, and they work very good. Even immunotherapies, they have no side effects except some autoimmune side effects. So they are, even for like the patients who have very poor performance status also, we can give them. So these are like, we can find, very like novel molecules, advanced targeted molecules, which are a great help for the patients nowadays.
Thank you, ma'am, for answering that. Also, you deal with lots of patients every day. Any that common myth or dispel that one dangerous myth you have heard about cancer that women believe, and what it is?
The first thing is that they kind of ignore, because most of the lumps, like breast cancer lumps, and most of the they are painless to start with. They kind of ignore. First thing is that, and they think it is just a benign lump. It will go away. That is a biggest myth. They don't go to doctor. They come to us after 1 or 1 2 years after it has advanced a lot. Second is the kind of second thing, they think ignoring symptoms like will the symptoms will go away, and they keep on ignoring things. And third thing, which actually bothers us a lot, in the caregivers of the patient who are diagnosed with cancer, they keep on asking us like, will we get the disease, like if we give care to our patient, if we eat in the same plate, or if we sleep with the patient. So generally, cancer is not a communicable disease. We keep on telling them it is purely mutational, purely at genetic level. So it has nothing to do with sharing the plate, or sharing the room, or sharing the bed with the patient. So these are the most common myths which keep on bothering us.
And I believe, ma'am, like you also explained, how do you counsel them? So all the myths goes away whenever you counsel, or the other doctors also counsel them. Ma'am, are there specific lifestyle factors that women often overlook but can significantly reduce their cancer risk?
Yeah, definitely. First thing I would say is, nowadays smoking and alcohol is becoming more prevalent in women also, and they are at a higher risk than males. If they smoke or take alcohol, they're at a higher risk than males in getting cancer. First thing, they should avoid this smoking and alcohol, because up to 50 to 60% of all types of breast cancer, cervical cancer, endometrial cancer, all types of cancer are directly related to smoking and alcohol. Second thing, obesity, which most patients overlook. Obesity is contributed to 30% of cancer, because it is as bad as smoking nowadays. So the patients, the normal women, should actually keep on exercising. It is seen like up to 30 minutes of exercise per day actually reduces the cancer risk, mainly breast cancer and this endometrial cancer, by up to 5 to 10%. So exercising regularly and eating a healthy food, so that the weight can be maintained at a proper level, actually decrease the inflammatory levels at our body, and decreases the cancer risk to a much better level. So obesity is the main thing they can kind of ignore. And third thing is, they should they are not aware of the vaccination techniques. I mean, for cervical cancer, if vaccination is taken at a proper time, so it can reduce the cancer by up to 98%. So they should be knowing that, which actually prevents them from getting cancer.
That's true, ma'am. I think for this we need a large mass counseling. So if schools to school, colleges to colleges, office to offices, we can have this counseling sessions and spread more and more awareness. Because I believe education is something which now everyone is getting educated, but they do not focus much on their health, the causing risk factors, and they still, they all these factors are included in their lives. I think we need to make our this audience more smarter. How can they avoid these kind of risk, and make their life cancer risk free kind of thing. Uh, Ma'am, we know that cervical cancer is preventable. We have its vaccine. So, other than that, with advancements in cancer research, do you see a future where more other cancers can become completely preventable or curable?
Yeah, cervical cancer vaccine we have, because it is caused by infection, human papillomavirus. So wherever, like whichever cancer is mainly related to infections, can be totally preventable by vaccines. The vaccines need to be many come into market for that. Even for liver cancer also, even hepatitis B is a very big contributory factor. So by HPV, by hepatitis B vaccination also, we can actually prevent liver cancer to a very significant level. Mainly I find this human papillomavirus. Other, like maybe we have this H. pylori infection also. Like if that is that we can eradicate H. pylori, or even we can decrease the risk of stomach cancer. Not to that level as our cervical cancer, but to a very significant level we can decrease stomach cancer also. Even Epstein-Barr virus infection is contributory to nasopharyngeal carcinomas. We can decrease that also if we have EBV virus vaccination. But it is again only 20 to like 10 to 20% of cases are contributory by Epstein-Barr virus. So we can decrease it to 10 to 20%. But it is a very breakthrough in cervical cancer because up to 98% to 99% of cervical cancer is due to human papillomavirus only. So that it is which we have achieved till now by vaccinating by getting a vaccine for the cervical cancer.
Ma'am, we know that we have vaccination available for cervical cancer, but still not many of have this, got them vaccinated. What could be the reason behind this?
First thing, as I'm again saying, lack of awareness. Second thing, that still it costs around 22,500 to something around 3,000. So some people might not be like might not be having, might not be affordable for many patients, many the low income strata patients. Third thing, it is not even available in many centers. Maybe it is available in tertiary care centers, but it should be available in primary point where the patients actually see to the in village area where the patients visit the primary doctors, primary that should be available there also. Every sector it should be available. So there is a big campaign going on to make this vaccine available everywhere. So availability is issue first thing. Second thing, cost is a second issue. Third thing, lack of awareness. I can say lack of awareness is a main issue.
Now, I believe just like the COVID vaccine, which we got when the COVID was around, I think that kind of mass campaign is required, wherein every small public health unit, the vaccine was available. You call it Anganwadi, you call it schools or everywhere. So all the
Mm.
workers were working around to get everyone vaccinated. So I think if we have the vaccine which can prevent this big cancer, then why not? I think this effort is required. A bit of this effort is required from the government, and then initiative this from the females of our country. That is a step required from their side. So yes, I think with that we can fight the cervical cancer. Ma'am, since we're talking about the cancer and everything, we know how emotionally it affects us. So, how important is counseling and emotional support and treatment? And do we need and integrate more psychological care into oncology?
Yes, definitely, it's a very important point. In many centers, in our center also, we have, oncological counselors. That is very important because they're actually very depressed when diagnosed with cancer. Generally, many patients are very depressed, and they generally feel like they're going to die, will not take treatment. Why should waste? Why should we be wasting money? Why should we be actually giving trouble to our family members? They will bring us. They will be like taking leave from their work, and they will be like taking leave for us. And at the end of the day, we are not going to be cured. So that is a main thing in patient's mind, which needs to be counseled, which needs to be addressed by oncological counselors. So there are specific psychological oncological counselors who are properly. They're actually and very good at their this counseling. So they take care of this counseling part. Second thing, patients should also like form the cancer support groups. They should be forming groups. They should be motivating themselves so that they can complete the treatment. They can ask any doubts, whatsoever is coming into their mind, and they can discuss with the doctors so that they can know about the outcome. They can actually get themselves properly aware of the outcome so that they can complete the treatment in a very smooth way.
Thank you, ma'am, for answering that question. And we know how important it is and what what stress everyone, every doctor, every healthcare worker puts on this. Because if they're emotionally balanced, emotionally in a mindset that they're ready to receive this treatment in a positive manner, then yes, this will cure me, then definitely the treatment works better. So that is a very important aspect of the cancer treatment journey. Ma'am, lastly, as we have come to the end of our discussion, and this is an ongoing celebration of International Women's Day, so what advice would you give to women today to take charge of their cancer risk and overall health?
Yeah, first thing I would advise I'd advise women to stay to make themselves aware about various risk factors of cancer and various signs and symptoms of cancer. Second thing, I would advise them to stay away from smoking and alcohol. Third thing, I would actually advise them to exercise regularly, to take healthy diet, to take fruits and vegetables, a lot of fruits and vegetables into the diet. And they should be aware of the vaccination that is available, that is cervical cancer vaccine, and they should actually be giving them to the kids available. Like vaccination age is 9 to 11 years, it works the best if we give it an early age. So they should vaccinate the kids available at their home. So that is the main thing I would advise them. The last but not the least, I would advise them to get themselves screened, like whatever screening techniques available for them, like breast self examination, which can be done at home itself, for mammography, which has to be done yearly for 40 years and above females, and various pap smear, HPV co-testing that is available. They should undergo them so that we can actually diagnose cancer at an early stage, and we can completely cure them by joining our hands with, with our doctors or caregivers.
Thank you so much, ma'am. Thank you so much for sharing your valuable insights with us. It means a lot to educate and aware our public out there, the audience who are listening to this, because this Women's Day, we want to focus more on the prevention, diagnosis. We know if we get it diagnosed early, then it is curable. The treatment rates increases. So thank you so much for creating that awareness with us. It's a pleasure to have you with us on this special occasion and celebration.
Thank
Thank you,
you.
ma'am.
Thank you. Pleasure discussing this.